never seen declines this sharp throughout the whole pandemic. And that's a direct result of getting some people who were infected the treatment that they needed. And so they were both instrumental in doing that and facilitating that. So I want to thank them. And I also want to welcome Joe Latipo to the state of Florida. I think he's going to do very well here. And certainly we're welcoming him with open arms. So Doctor, the floor is yours.
Hey, hello, I have to check my watch because I'm in a different time zone. Okay, so good afternoon. It's a pleasure to be here. I'm just really very happy to be here in Florida working with Governor DeSantis and the leadership here in Florida to really think thoughtfully and in a very positive way about our public health here in Florida. And frankly, hopefully set an example for other states around the country, and maybe even further than that. So I'm really just honored and overjoyed to be here. My family is looking forward to coming. You know, we've sold the kids. We've got 3 boys, so they know Disney World is here, and they're looking forward to that. And whatever, anytime they have complaints, we mention Disney World, and everything's okay again. So I'm very happy to be in this position, very happy to be joining the faculty of University of Florida also. And I talked to the governor, and there are a few things that we're gonna keep in mind as we approach public health here in the state of Florida. So the first is that Florida will completely reject fear as a way of making policies in public health. So we're done with fear. That's been something that's been, unfortunately, a centerpiece of health policy in the United States ever since the beginning of the pandemic, and it's over here. Expiration date, it's done. So we're compassionate, we get it. You know, there are scary things. We've seen a lot of fear from COVID over almost the past year and a half, and it's very understandable. But the way to approach that is not from a place of fear, because it doesn't lead to good decisions. And we've seen a lot of that, where the risks and benefits of decisions haven't been considered wholly or thoughtfully. So that's over here. In terms of our approach, we are going to have a positive approach. We're going to acknowledge the fact that, there are some things that are scary, but that's not the only thing. That's not the place that we're going to make decisions from. So we're going to really think globally about the health policy decisions that we make in this state. The second thing that I plan to be sure is very clear in our policy making is that we're going to make it very explicit. We're going to be very explicit about the differences between the science and our opinions. So we all have opinions, we all have a perspective, and we are absolutely entitled to those perspectives. What's been happening over the past year is that people have been taking the science and they've been misrepresenting it. They've been using the science, and it's been unclear when the discussion about the science ends and discussion about how you feel about the science and what you want people to do with the science begins. And that will never be a problem here. That's never going to be something that we do here. You'll know when we're talking about data, and you'll know when we're talking about our opinions, our impression, our preferences about the data. That will always be clear here. So you can count on that. And then the third thing is that we are going to never lose sight of the fact that public health is not one thing. So public health is not about a single item. It's not about how many cases of COVID there are in a location. It's about, and that is a part of public health, but it's not the only thing. And as all of you know, that's how public health has been treated over the past year and a half. So that's over. It's not going to happen here. We're going to keep. We'll be interested and concerned about all aspects of public health that we think are important, and that goes for it goes for schools. So this as just a perfect example of how glaringly we've ignored what public health really means has been how we've just brazenly pulled children who need the structure of school and need the structure of a routine in their lives out of school and done that. And we've done that for it's terrible to do it for all kids, but we've also done it for kids with disabilities. And people have hardly even batted an eye. So our interest in public health will truly be public health. It will not be sort of one thing or whatever the flavor of the month is going forward. So those are the main items I wanted to communicate to you all. And again, we're really excited about coming here to Florida. Really happy to be here.
Anyone have any questions?
I'm sorry. Go ahead, please. Oh, sure. Yeah, no. So before I answer your question, I'll tell you that, part of that fear that you're talking about and part of, I think you said, did you say conspiracy? Conspiracy theories? Sure. So part of why that is an issue is because of the climate of distrust that has been engendered over the past year and a half. And that was a direct result of scientists, my colleagues, some of them, taking the science and basically misrepresenting it to fit their agendas, their interests, what they wanted to see people do. So it's partly a product of that. And in terms of that, I think vaccines will treat like any other preventive issue. So the goal will be education, and that will be the goal. And this idea that people don't get to make their own decisions, on issues of health related to their own personal health is wrong, and it's not something that we're going to be about. So we're going to be about education. We're Well, that's an interesting question. So there are good reasons to reject lockdowns. There are a lot of them. They don't even have anything to do. They don't even have to have anything to do with fear. So one of the things, again, with misrepresentation of science, is that a great study, a really high-quality study, came out of the National Bureau of Economic Research a few months ago, and no one heard about it because it didn't fit the agendas that some of our public health officials have been advancing. And that study that showed that in the United States, after lockdowns, overall mortality increased. I'm just going to say that again. After lockdowns, overall mortality increased. Lockdowns are bad. Lots of reasons why they're bad. That's just one really good one. Yes, I am. In fact, Jay Bhattacharya is a good friend of mine. Yes, I am. Yeah. And I think, part of the reason, I think, again, just sort of the step back here. So there's this idea that, that things are black and white. You wear the mask all the time or you don't, or you have to have the vaccine or you don't. And even with that Great Barrington Declaration, there were a couple things. I talked to Jay before he made it public. There were a couple things that I didn't totally agree with, but the spirit of what they believe, that that we need to respect human rights, that people do have autonomy over their lives, and it's not okay to. It's not even not okay, but it's not virtuous and it's not right to just sort of take away those rights from individuals. Completely agree with that. That's why I signed it.
So you didn't mention vaccine promotion. Is vaccine personal choice that you see as something that's up to the person? You're not going to.
Okay. So just to be clear, you asked a few things there. So vaccines are up to the person. There's nothing special about them compared to any other preventive measure. So absolutely, great things about vaccines for COVID-19, prevent the risk of serious illness. Fantastic. People get to make a choice about what they want to do with that information.
Do you think the state should be promoting that?
The state should be promoting good health, and vaccination isn't the only path to that. It's been treated almost like a religion, and that's just senseless, right? There are lots of good pathways to health, and vaccination is not the only one. So we support measures for good health. That's vaccination, losing weight, it's exercising more, it's eating more fruits and vegetables, everything. We support it all.
How did the University of Florida get wind of your appointment as Surgeon General and tell their faculty about it? You had to go to this 10-year
We'd have,
Talk a little bit about that, or can the governor maybe?
Well, I mean, so he did the university separately, and that was not, that was just based on his credentials. And then, no, so I don't think anyone who interviewed him knew that he was going to be appointed this. That wasn't anything that we had done, and obviously we wanted to see how that shaked out before we formally offered him. But I view it as, look, University of Florida, number 5 now, public university. One of the top is UCLA. It's ahead of us. To be able to get someone of Joe's caliber to a Florida university, that's a coup in and of itself. And yeah, I'm happy that he's going to do this job, and I think he's going to do a great job. But that's a big deal. And so I think any university would be foolish not to want to get this guy.
Absolutely. Was there any
Eric,
communication
do you have any
between the governor's
questions?
office and the university?
Eric, go ahead.
To follow up on what Jeff was saying, seems that Archbishop was under with
Well, remember when the legislature provided additional for some of the folks, and so the salary for the Surgeon General is now higher, and then you do have a similar arrangement where you will be at UF and then also be doing. I think it's a similar contract. Yeah, I think that's. I have not reviewed. Yep, we'll give you the answer on that.
but do you want to ask me what you really want to ask me?
Well, I would just say, one thing, I'll let Joe answer, but I mean, it's declining everywhere in Florida now, in all the schools. I mean, remember, we had kids back in school, millions of kids coming back into the classroom, and what happened at the very height of this, and since all that has happened, it's continued to go down. So this idea that somehow schools drive this and that we can't have kids in school, that should be definitively proven wrong. It was proven wrong last year. But from where we are now versus where we were before with all the kids in school, and I would also say you look at the different, most of the districts follow state law. They're providing parental choice with masks. There's a few districts who have kind of gone rogue and they're forced masking the kindergartners, first graders, all that stuff. There's not any difference. It's going down everywhere. And so I just think that, the doctor mentioned having kids out of school, that's a health issue too, because that is devastating. And so we've worked really hard last year to do it. We're working really hard now to do it. And we're going to be working on, when they say schools close, it's usually not because everyone tests positive. Someone will test positive, and then they send the healthy kids home. That needs to be reevaluated. That's not how they do it in most European countries, and they've had very positive results. And so I know we're going to be looking at that because, quite frankly, you talk about Parents' Bill of Rights. A parent has a right to have a healthy kid in school. What are you going to say? You pass someone in the hall, and so you got to sit there for 10 days or 14 days? That has a huge cost on kids' upbringing. And so, but the data is very clear. And I remember a month ago, we knew the data because we've seen this play out. But everyone was saying, if you give parents a choice, you're going to have, major outbreaks leading this. And in reality, not only are we down with everything, and we are big time down with pediatric admissions, but we're down ED visits. We're down huge on hospital admissions. The census was down 8% today on a Tuesday, which usually is an increase because of the way they do discharges. And then, of course, you're seeing the cases go down dramatically as well. So keep these kids in school. If someone's sick, by all means, you send them home. But healthy kids, they have a right to be in the classroom.
Yeah. Right. Well, I'm discussing that with my team in terms of recommendations. It's complicated, right? There are factors that may be specific to different school districts. So we're discussing what works best for.
Going forward, reflecting a little bit on you.
There you go, Stefan.
Yeah, as a scientist, this is one of the most startling aspects of the pandemic for me in terms of what some of my colleagues are saying and doing. It is, I mean, you know, you don't need to go to medical school to look at the data and see that there's really great protection, you know, terrific protection, durable protection, robust protection, sort of variant protection that confers some resistance to variants. And obviously the story is still being written, so we don't really know, you know, exactly what's going to happen in the future. There's tremendous data that supports the fact that, you know, that natural immunity protects people from getting very ill, also protects people from being infected again. And so that's what it is, and that's great.
I think, let me talk. So, but I think this is important with natural immunity and why people in these experts have tried to act like it doesn't exist, because, and I think you were going to ask this question, they think if you tell people recovery from COVID provides strong protection, that some people say, oh, I might as well just go get infected. I have that. And I don't think most people would do it. But even if someone does, you have to say the truth to people. You can't tell noble lies to try to get them to behave in a way that you think you want them to behave in. And so we see that time and time again on this issue of natural immunity. Clearly, if this wasn't something that was durable, you'd have massive reinfections by now. And so that's just the reality. I think if you look at what's going to mediate future waves, that natural immunity is going to be a huge part of it. We have a lot of people who are vaccinated and they're getting infected, mostly mild. That is building immunity effectively as well. But I think Joe understands, no noble lies. You tell the truth on what the data is saying. You don't, and the same thing with the treatment and the antibodies. Part of the reason when I rolled out the antibodies, we were in the midst of a wave. Okay, people like Fauci said if 50% were vaccinated, you would have no more surges. We had that. In fact, our seniors were over 90%, and yet you see admissions going up. So what do? And people were saying, well, most of these people aren't vaccinated who are being admitted. True, 100%. I wish that they had been. I think many of them probably wouldn't have been admitted. At the same time, when you're in the midst of a wave, you can vaccinate immediately. It doesn't kick in for weeks, probably 6 weeks after that. So what are you going to do to help people in the meantime? And we were seeing people who were vaccinated getting infected. We hoped that it would produce sterilizing immunity. Remember the Pfizer trial, 95% reduction. That's clearly not happening. I mean, we look around, people are getting infected. The role that vaccinated people play in spreading it, I don't know, but I can tell you, I think every state in the country had higher cases this summer than they did last summer when no one was vaccinated, so it'd be hard for me to think it's only occurring amongst a small slice. So nevertheless, we saw that, and we knew our most vulnerable people overwhelmingly were vaccinated. So what do? Well, we had an effective treatment that's been emergency use since the end of 2020. It was used on the President of the United States to help him recover from COVID. This is something that many of our hospitals were using, but it was something that almost none of these people being admitted to the hospital even knew about. Many physicians, as of last month, were still telling people, okay, go home, hope you don't get deathly ill. If you get deathly ill, then go to the hospital. There was never any interest or belief that this should be treated or even could be treated. I don't know why. But I do think that one of the reasons why this was not something that was put out there very publicly by the experts and by the powers that be in D.C. is because they feared that if you tell people there's an effective treatment, if you tell people COVID's a treatable illness, they feared some people would say, well, you know, maybe I won't get vaccinated, I'll just get the treatment. And so they didn't want that message out because they feared how people would behave. And my view is, we've always said it complements. If you want to cover all your bases, do it as a complement, but you can't not tell people that this is something that's available. And so the result is, when we started doing our push, I was attacked for it, saying you're not supposed to do it. We did it, we raised awareness, which is very important, and then we expanded access. And the result has been, I think we're at, 29 straight days where the hospital census has declined, 8% reduction in the census as of this morning, ED visits, this is all tanking, and it was the right thing to do. Now you have other states where they're now following Florida's lead. I get people will write into the office here from these other states thanking me because they didn't know about this, and so they started bothering some of their doctors in these other states to be able to get this. So having the treatment is the right thing to do. I think increasingly as we see more vaccinated people test positive again, I think most of the time it's going to be a mild case and you're probably not going to need this, but we are seeing some very vulnerable people who have been saved for this. And if you look at some of the places, I mean, Miami, I think it's like 60-some% of the people that have gone to our treatment site in Dade have been vaccinated. Broward is, I think, 52%. Some of the other sites, more rural areas, the majority are unvaccinated. And I'd say overall, you're looking at 40 to 45% of the people statewide that have gotten this treatment have been vaccinated who were either infected or were exposed and are in high-risk situations. So telling the truth, I think, is important, and I think that's what Dr. Ladapo understands, that you got to tell people the truth and you got to let them make decisions. They may not always make the decision that you want them to make, but I think that's much better than pulling the wool under their eyes. Now, we have a situation in Florida now where, in spite of this data, where we see far fewer people being admitted to the hospital, thankfully, we're seeing people kept out, we're seeing lives saved. The Biden administration has dramatically cut the share of first of all, they seized control of the supply nationwide, and now they're dramatically cutting what's coming to the state of Florida. That's wrong. That is dead wrong. And why are they targeting Florida? Biden, he loves talking about Florida. He hates Florida more than anything, and this is absolutely going to hurt people. We're going to work like hell to make sure that anyone who needs it, we're going to figure out ways to be able to do. I hope to have an announcement on that soon. But how could you cut it given all the things that we're seeing on the ground? And you don't even need, you can look at the hospital data. It's very compelling. Just talk to people that have gotten this treatment. Talk to them about how they were feeling, where they feared this was going to end up, and then what happened after they were able to get the treatment. It's been something that's benefited thousands and thousands and thousands of Floridians. They say there's no supply problem, but they're doing this anyway for temporal equity. I think it's because they fear a similar wave happening in some of these other parts of the country later on in the year. But if they don't have enough of it, then that's mismanagement on their part, because this is something that's very significant. I know they did another deal with Regeneron, but they should absolutely be sourcing the needs. Now, fortunately, our sites are down probably 40% from the peak in terms of the people going in, because we have fewer people that need it right now, which is good, and hopefully that continues to go down. But why would you cut it now, given the success that we've seen? So we're going to absolutely fight back against this. We have ways to go around it potentially, and so hopefully we'll be able to finalize that. But cutting these treatments is wrong. And there's a time for politics. I get that. But, to be so obsessed with trying to kneecap Florida any way you can that you would take away life-saving treatments, I'm sorry, some things should be beyond politics. I don't know who the hell is going to our sites. I don't know their political affiliation. We just want to help people, and obviously Joe Biden feels differently. I'll do one more, then I got to run.
Question for the doctor.
Okay.
Doctor, consider California and what your can you give us an
It's actually, your question highlights just one of the examples of confusion with thinking about the pandemic. Different places have factors that contribute to surges and how ill people become that we don't fully understand yet. I mean, no one knew that Florida would have a surge during these past several weeks. No one knows when the next one's coming in California or in some of the northeastern states for sure. So basically, I think the game of sort of doing these state-to-state comparisons and saying so-and-so, they did a good job and they didn't, I think that is a silly game. I think that what we need to be doing is thinking about the people in the state, their circumstances, what their values are, what their constraints are, and doing the best we can for people in each state.
All right. I think we're good. See you guys.
Okay. Bye-bye.